DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. Today we're going to have a great show. Dr. Randall Spare is here from Ashland, Kansas, and we're going to talk about weak calf syndrome. And we're going to talk about things about how to prevent it, what we saw this winter, and things that you can do. It's going to be a great show. Thanks for joining us.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Join us for the 4th annual Meeting Demand Sale at Gardner Angus Ranch, Monday, May 13th at 10 a.m. Up for sale are 173 20-month-olds and 250 bred commercial cows and heifers, including the complete dispersal of longtime Gardner customer YOLO Ranch. Catalog available at GardnerAngus.com. Register for online bidding at liveauction.tv. At Gardner Angus Ranch, you aren't just buying a breed, you are buying a brand backed by 4 generations of disciplined seed stock production. See you May 13th at the ranch.
Closed captioning brought to you by Vet Gun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome to DocTalk. I'm here with my friend, Dr. Randall Spare, and Dr. Spare is the president and co-owner of Ashland Veterinary Center in Ashland, Kansas, and he's been a dear friend, a mentor to me, and to have him here on the show is just thank you.
Well, Dan, it's certainly an honor. You're an icon in the veterinary industry and such a pleasure. You do so much next to James Harriet for all of animal agriculture, and I appreciate that so much.
Well, you're very kind, and that is humbling. Dr. Spare works on cows, calves, in some of the best operated herds across the country, and is a leader. And today we're going to talk about the slow moving calf, or that weak calf that's born. And just first of all, just kind of describe what we've been seeing this spring. You know, Dan,
it's been a long winter, and that winter started back in January for some people as early as Christmas time, when we had blizzard in Guyman, Oklahoma, and Garden City to extend it on north. And so we had tremendous weather pressures on these cattle, and increased their nutrient needs. And our calving season in the Midwest starts from January 1 to June the 30th. But any time during that time period when we had weather stress on, then we had cows near calving that were either born dead or born alive, then soon died. And whereas normally we'll have maybe 1%, we had up to 5 to 7%.
Wow.
In some herds. And just caused lots of challenges this winter.
Yeah, and those calves are the ones that aren't strong enough to get up and suck. They're listless. They wind up getting secondary disease issues and diarrhea. All the above?
All the above. And it all relates to what those cows are being fed beforehand, which relates to how strong and vigorous those calves are when they get up. And then, is colostrum available? Is colostrum available to them? Can they get it? Can they get enough of it? I consider colostrum as liquid gold. If they don't consume colostrum in that first 4 hours of their life, then they're going to have more challenges. They're 3 times more likely to get sick, 3 times more likely to die.
Yep. Well, and the energy that comes with colostrum. It's more in fat, more in protein compared to the second milking or the third milking. And so just the energy getting into those calves. But, you know, when we start to think about that and getting those calves warmed up and getting them to where they can suck, I think it's important that we take care of that.
Absolutely. And then, you know, sometimes it's as little as getting those calves in our pickups and getting them warmed up, getting them back to where they can maintain their own body heat, and then getting them some milk into them. But the real problem to me is goes back to nutritional challenges. And we have to know and understand what's in the forage that those cattle are going to eat.
Let's take a break here, and when we come back, let's jump into forages and nutrition. Folks, you're watching DocTalk. I'm here with my friend, Dr. Randall Spare, Ashland, America. We'll be right back after these messages. Hey folks, thanks for joining me on today's Cattle First Minute as sponsored by Behringer Ingelheim Vet Medica. Today, we're going to talk about colostrum. Colostrum is the first immunity that a calf receives in its life. Within the first 6 to 12 hours of life, we want that calf to get up and suckle the first milk from the mother. That first milk is what we call colostrum, which is packed with antibodies, which then help protect that calf from viruses and bacteria such as E. coli and scours, in which the calf will be exposed to on the farm. The cow is a great source of antibody because she's been living in that environment, been vaccinated for different diseases. She produces those antibodies in the colostrum. We want the calves to be able to get it in the first 6 to 12 hours. So wait to tag that calf until after that calf has had a chance to get colostrum, because it's vitally important for the calf's health, and it's the first step towards raising a healthy calf.
You spent countless hours building a strong operation. But when it comes to trichomoniasis, the odds are stacked against you. It takes just one infected bull to take down the whole herd. Damage could include open cows, lost pregnancies, and lost profits. The good news is, with TrichGuard, a herd doesn't have to feel like a house of cards.
Join us for the 4th annual Meeting Demand Sale at Gardner Angus Ranch, Monday, May 13th at 10 a.m. Up for sale are 173 20-month-olds and 250 bred commercial cows and heifers, including the complete dispersal of longtime Gardner customer YOLO Ranch. Catalog available at GardnerAngus.com. Register for online bidding at liveauction.tv. At Gardner Angus Ranch, you aren't just buying a breed, you are buying a brand backed by 4 generations of disciplined seed stock production. See you May 13th at the ranch.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
All right, folks, we're back at DocTalk. I'm here with my friend and colleague, Dr. Randall Spare from Ashland, Kansas. And Dr. Spare is a practitioner's practitioner, and he is out in the country, and he tends to, I would be amazed at how many bulls you've tested and cows you've pregged that have influenced the genetics across this country.
Well, Dan, that's humbling. You know, our goal is just to help people be successful and be profitable one day at a time. And I love what I do. I love coming to work, and I enjoy it when young producers get into the industry, and I'll do anything to help them to succeed.
You bet. And speaking of that, one of the things that we didn't get a lot of exposure to in vet school, but we learned a lot of it when we got out, was nutrition. And as we left, kind of talking about the nutrition of those cows and leading up. You mentioned the long winter and the hard winter. Man, we burnt through those hay piles and feeding our cows and different things. Talk to me a little bit about that.
Well, Dan, we have to understand what is in that hay. Just because it's sorghum sudan grass and it's normally 5% protein, well, we understand the protein and energy can vary from year to year. And if we're balancing with, we feed 2 pounds or 5 pounds of 20% cake every year, well, that may not be feeding to what their nutrient needs are if that protein in that forage is at 3%. If it's been rained on with the forage, the main thing that cow digests, we have to know the nutrient content of it, and then we can adjust those protein supplementation accordingly.
It just amazes me, and I'm sure you too, but how much that hay pile's worth and how much those cows are worth, and that's our livelihood, and it's something so simple as testing that forage will give you the answer to prevent this 5 to 7% slow calf or weak calf syndrome rate.
That's correct. And so many times, Dan, people come to us and say, I need to give a new vaccine to my calves to keep them from getting sick. And I'm thinking, how about we feed a little differently today and tomorrow? And to adjust that, we've got to get out of this situation. But right now, Dan, let's think about next year and how we create margin in those cattle for next calving season.
Absolutely.
Now's the time that we need a plan for that.
Yep. And the other thing is you've mentioned, with the nutrition, is the genetics can play a role. And I don't know that we have time to get all the way through this before the break, but you talk about, everybody said that for calving ease bull, you're supposed to pick the top 30%.
Well, and that goes to show, Dan, we know that dystocia has an effect on survivability of those cattle, which has effect also on breedback. But today we have the possibilities to pick top 5% calving ease and still have top 10% growth. That's a no-brainer. That's a no-brainer.
I just think that when you're sitting there, if you're buying a car or the best value, it goes right back to the same sort of scenario. And so let's take a break. When we come back, we'll touch a little bit more on genetics. We'll move on to some more management things. We're really lucky to have this guy here. This is Dr. Randall Spare. Hey folks, thanks for joining me on today's Cattle First Minute as sponsored by Behringer Ingelheim Vet Medica. When we start to think about breeding season and turning bulls out, the one thing I can't emphasize enough is to get a breeding soundness exam done on your bulls before turnout. And some of the things that can happen during the winter, whether it's frostbite in certain areas of the body or there's things that can happen that will cause a bull to become infertile, are things that you need to make sure. The other thing that's very important on a breeding soundness exam is we have to make sure that we don't have lameness or issues with the feet, because no wheels, no calves. So making sure that we have a sound bull structurally, making sure that we have one that's fertile and one that can produce enough sperm and enough volume with enough motility with no defects in the sperm is vitally important to making sure every year before you turn out to ensure that you get a calf crop, at least from the bull's point of view.
You spent countless hours building a strong operation. But when it comes to trichomoniasis, the odds are stacked against you. It takes just one infected bull to take down the whole herd. Damage could include open cows, lost pregnancies, and lost profits. The good news is with TrickGuard, a herd doesn't have to feel like a house of cards.
Join us for the 4th annual Meeting Demand Sale at Gardner Angus Ranch, Monday, May 13th at 10 a.m. Up for sale are 173 20-month-olds and 250 bred commercial cows and heifers, including the complete dispersal of longtime Gardner customer YOLO Ranch. Catalog available at GardnerAngus.com. Register for online bidding at liveauction.tv. At Gardner Angus Ranch, you aren't just buying a breed, you are buying a brand backed by 4 generations of disciplined seed stock production. See you May 13th at the ranch.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Randall Spare. we're here at the PAC Summit in Manhattan, Kansas, and I grabbed him away from the crowd. He gave a great talk this morning on rural veterinary shortage. He's heading up our task force here in Kansas. We're going to tackle this thing. We're going to make rural veterinary medicine in Kansas great again.
You know, Dan, I love what I do. Love going to work every day and helping our people be successful. And that's using the resources that they have and having profitable cattle operations.
Yep. And you do a great job of it, and we love it when you come teach our students or when you come talk with our producers or our veterinarians. And you know, I think that we forget. We think about that weak calf syndrome. We think it's always a matter of fact after the calf's born or something, BVD or something like that. And you know, what you've really taught me is the nutrition of those cows, the vigor of those calves, the power of that colostrum. But going back to that genetics.
You know, Dan, I talked today more about which genetic choices that people need to make more than vaccine. In combination, if we look at genetics and nutrition, that's a huge cost in an operation, but also more importantly, probably to look at it as an investment. When we invest in nutrition right and genetics right, then we're a lot more likely to succeed. And you know, the first place to do that, and science today has where we can develop calving programs such that we have the I call the Columbus method of calving. You know what that is? That's when we go out every day, maybe just twice a day in our virgin heifers or first calf heifers, and we discover who's there. Today we have the tools of easy calving and a predictable calving, and the most challenges we have is mating up. If we use top 5% growth or top 5% calving ease, and we know these cows are going to calve easily. We have very little difficulty. We have some semen that people have used that have 600 pregnancies, and they had 6 cows, heifers that they assisted.
Wow. I like the Columbus method. Going out and discovering who's born versus going out and watching them every minute.
That's a waste of time today. You know, what's our biggest challenge? It's labor. It's what we're talking about today. Trained labor to go out and help people calve out their heifers. We don't need that today because we do have the technology.
Yep, and those papers that we reviewed is that the bigger the calf, the higher likelihood is of dystocia, and the higher likelihood of, and dystocia doesn't mean that you have to assist, just a difficult birth will increase the chance of that calf being weak because it is exhausted from the birthing process.
That's right, it has muscle damage.
Yeah, and so if it can't get up, if it's stoved up, it's got high lactate, it's not going to be able to get up and get that colostrum, get the energy, and we're going to have weak calves from that scenario.
That's right. And that's going to affect our reproductive rate the following year, and those animals can, let's face it, that first calf heifer is the most valuable animal on the place. She has the most investment in her.
Absolutely.
We want her to succeed.
Yep. When you go out and you're working with your clients, what are some of the things that when you first tell them, when they're going to, if I have some new heifers and I want to select a bull, what are you telling me?
So I've learned, Dan, even after I've practiced a number of years, the first thing I do is I ask them what their goals are. Ask them what they want to do, what they want to accomplish. And then I said, well, here's some tools, and here's some bulls that might fit that for you. You choose which one you want. I narrow the choices down, and then we can look through according to which one has the most growth, which one might have the best carcass qualities, or this bull over here you might get it all. A low birth weight, high growth, high carcass quality animal that's going to succeed on the rail.
It's awesome.
I think we can have it all in this world today.
Absolutely. We're going to take a break. When we come back, a wrap up here with Dr. Randall Spare.
Join us for the 4th Annual Meeting Demand Sale at Gardner Angus Ranch, Monday, May 13th at 10 a.m. Up for sale are 173 20-month-olds and 250 bred commercial cows and heifers, including the complete dispersal of longtime Gardner customer YOLO Ranch. Catalog available at GardnerAngus.com. Register for online bidding at liveauction.tv. At Gardner Angus Ranch, you aren't just buying a breed, you are buying a brand backed by 4 generations of disciplined seed stock production. See you May 13th at the ranch.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Some call it a come from behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Back here with Dr. Randall Spare from Ashland, Kansas, who's a bovine practitioner and a leader in the beef industry and in the veterinary profession. And recently, Randall and I are both kind of the new members of the PAC organization, and we've taken on 20 other practices now recently: Montana, South Dakota, Iowa, Missouri. You know, if you have you are a veterinarian, or if your veterinarian has interest in looking at PAC, you can go to pacdvms.com and contact Lisa Taylor. Here's her email address, and get a hold of us and see what we can do to get you set up to be a part of our fellowship and professional group.
You know, PAC is doing just that. Sometimes as veterinarians, particularly in rural areas, we feel isolated. There's not that strength of multiplication there, and I think that's what an opportunity that PAC has and brings to the table, of people that want to practice good science with people of integrity and be data driven, and that's what it brings together.
Yep, it's a group that when you're down will lift you up, and likewise when I'm down, I know they're going to lift me up. So it's good. Contact us. The email's there, Lisa Taylor and PAC DVMs. When the calf's on the ground and we have those weak calves, what are some things that we should do?
Well, obviously we need to get them warmed up. You know, when we know a calf is warm, its intestinal tract starts to move, it starts to absorb colostrum, starts to absorb milk, and then get it out of the wind, get it dried off, and then if we need to, we may have to administer some electrolytes that'll balance out its pH, Dan.
You bet. And that pH, it gets back to these calves, you know, if they go through that fatigue of that difficult birth, they could have increased lactate buildup, which will decrease the pH of the blood, which makes those calves just awkward and moving. If you've ever gone to your first football practice and the coach gets done running you and you don't remember how to get to the locker room, that's kind of what those calves are going through.
That's right. It's just a real practical, common sense husbandry tool that will work. And those are the kind of things we need to do.
Well, thank you very much for being on the show. Thank you for being a dear friend and colleague. Folks, Dr. Randall Spare. Remember, if you want to find out what we do here at DocTalk, you can find us on the web at www.doctalktv.com. Always work with your local practitioner. Thanks for watching us today from me and Dr. Randall Spare, and we'll see you down the road.
Closed captioning brought to you by Vet Gun with Amel and new AMA Apomectin Vet Caps, the 1-2 punch against hornfly resistance. From AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
DocTalk was brought to you by Merck Animal Health, the science of healthier animals.